Can sigmoidoscopy detect precancerous polyps early enough? Imagine catching a problem before it becomes serious. That's exactly what sigmoidoscopy aims to do when it comes to colon health. This procedure allows doctors to look directly inside the lower part of your colon, especially the rectum and sigmoid colon, which are common sites for early changes that can lead to cancer. Because it examines only the lower third to half of the colon, it's particularly good at spotting precancerous polyps and early cancers in this area. Detecting these early gives you a real advantage, as removing polyps can prevent them from turning into cancer later on. Research shows that sigmoidoscopy can find about 70% of colorectal cancers and polyps, mainly those in the distal or lower part of the colon. While it doesn't see the entire colon like a colonoscopy does, it still plays a significant role in reducing the risk of colorectal cancer. Large studies have demonstrated that screening with sigmoidoscopy can cut the number of new colorectal cancer cases by around 20% and decrease deaths from the disease by about 26%. This means many cancers are caught early enough to be treated or prevented altogether. One of the reasons sigmoidoscopy is popular is because it's safe, less expensive, and quicker than a full colonoscopy. It's also better tolerated by many patients, making it a practical choice for widespread screening. If doctors find polyps or suspicious areas during the procedure, they usually recommend a follow-up colonoscopy. This allows for a more thorough examination and removal of any polyps in the entire colon, not just the lower part. Removing polyps early is key to preventing them from developing into cancer. It's important to note that while sigmoidoscopy is effective for detecting issues in the lower colon, it does miss lesions higher up in the colon. That's why some people may need a colonoscopy for a complete view. However, starting with sigmoidoscopy can still make a big difference, especially in populations where full colonoscopy isn't always feasible. In summary, sigmoidoscopy can detect precancerous polyps early enough in the lower colon to significantly lower the chances of developing colorectal cancer. It's a valuable screening tool that, when combined with follow-up procedures if needed, helps protect your colon health. Always consult with your healthcare provider to decide the best screening plan based on your personal risk factors and health history. Remember, early detection saves lives, and screening is a proactive step toward maintaining good colon health.